Hello, this is Dr. Jason Hayes, and your candidate for Lieutenant Governor here in the great state of Georgia. Today is the day. We are doing the podcast series Beyond the Race. You're going to learn about me, why I'm running for office, and also why it's important that we research, learn about candidates, get them in office, and also we're going to talk about hot topic events that are going on today with current events politically, things like critical race theory, things like Medicaid expansion, things that are important to all of you right here in the great state of Georgia and also coast to coast here in the United States and abroad as well. So we're going to go ahead and get started with Beyond the Race, the podcast series starring Dr. Jason Hayes, your host, candidate for Lieutenant Governor here in the great state of Georgia. So honestly, I'll be totally honest with you. I'm excited about what we're doing. And for many of you, you've seen some of the advertisement about Beyond the Race, the podcast. What is this guy going to talk about? So it's appropriate for me to talk about myself, who I am. I mean, you can easily go to the website and look and see who this guy is, where he comes from, where he was born, what he's about. But it means a lot more whenever you can actually see me, hear me, and get the story straight. So I'm going to go ahead and get started, and let's go ahead with it. So the biggest question I get all the time when I'm talking on the campaign to people is that, hey, why are you running? What makes you a great candidate? So I tell people, I said, this is what I was born to do. You know, the two things that we learn in life or that are most important is the day that we're born. And second, why we're here. So for me, my whole life has always been about dealing with social issues, dealing with things at home and seeing the world for what it is. And I've always had the desire and the will to say, hey, I need to do something. For a lot of people, when you look at my story, you see that I was born in New Jersey. Mother and father are both from Louisiana. Mother's a nurse, strong person, my mentor, my leader, the reason why I became a doctor. And my dad, a vet, Navy vet. He had a lot of trauma, a lot of things going on with him. But he did his best as my dad. Sadly enough, he did pass away in 2018. But the both of them, mother and father, married in 1969, moved to Trenton, New Jersey. Actually, my dad was very close to his uncle, Earl Talbert, who was actually a pastor himself. He actually taught at Southern University of Louisiana as a professor, but early on he moved to New Jersey. So my dad naturally followed suit after he finished being in the Navy, and just decided to go ahead and try something new. He actually decided to go into the what we call the Navy Corps after he finished being in the Navy. So he was in Bainbridge, Maryland, and essentially. He and my mom had 3 children, my older sister, Jamie, middle brother, Terrence, and I'm the youngest. So after the first 2, brother and sister were born in Trenton, they moved to Willingboro, and that's where I was born in 1977. So New Jersey was, I have fleeting memories of it. You know, Willingboro is essentially in the greater Philadelphia metro area. So mom and dad in 1980, they ended up moving back to Louisiana. My dad was transferred with the job that he had. And, shortly after they divorced. But, my mom, we had great family support in Louisiana. And so, it takes a village to raise a child. So I actually had a lot of great support from family and was raised not only by my mom, but also by my grandmother, my maternal grandmother. We called her grandma, and then my uncle, he had Down syndrome. He was there. So had some great times there in Opelousas, Louisiana. Great family gatherings that we had, especially during Thanksgiving, Christmas, New Year's. So I have a lot of cousins in Louisiana. That's the Simeon family. And some people, they hear the word Simeon. And if you're from Louisiana, it is Creole. So a lot of us there, I would hear my grandmother speaking a little Creole when we were younger, but a lot of times that was whenever, she would get upset with us. So, but Louisiana, it's a great place. I mean, much like Georgia, working class, rural, a lot of people there, they do their best. They work really hard. and family is huge. On my dad's side of the family, it's the Hayes and also Talbert, which is my grandmother's maiden name. Educated people, and not to say that my other side of the family wasn't educated, but my mom's side of the family were working class people. My grandfather, actually, my mom's dad, actually had his own mechanic shop, and he also, drove buses. And my grandmother was a homemaker, and she grew up on a farm. But in contrast, my dad, his side of the family, they were school teachers. They went to college. As a matter of fact, my grandmother and grandfather went to historically Black college and university in the Baton Rouge area, and this was Lane, excuse me, not Lane College, but a college in Baker that they went to, and it was a great institution that they got an education from. And many of us in Louisiana, we look at the HBCU scene, and it's a Southern University. There's Grambling, but my grandparents, they went to Leland. It actually escaped my mind initially when I spoke, but it's Leland College. It's currently defunct. It's in Baker, at least it was in Baker, but a lot of their records got transferred over to Southern University. So essentially, that side of the family, grandmother, 40 years in the education system. Grandfather, he got his education, but he also was in the military as well. So he had a career outside of the military. Well, he was a master drill sergeant, and then also he taught history and English afterwards. So had great times with them as well. But growing up, education was my thing. I consider myself someone who loved school, and I was considered gifted. So and I loved learning about math, English. So that was my thing. Thought, hey, I'm going to go into medicine. My mother's a nurse, observed, her supervisor, her employer, Dr. Kinchin. So, decided to move forward and go into medicine. But before I did, I actually got exposure to politics. A lot of people probably heard of this program, this Girl State and Boy State. It was sponsored by American Legion. And, the top two, that is young man, young lady in high school, actually had an opportunity to go. And I was fortunate enough at the age of 17 to go to Boy State and did that program, and actually ended up, winning a House representative seat, and just learned a lot. Learned a lot about city government, parish or county government, even learned about state government. So little did I know that experience actually shaped a lot of myself moving forward. So graduated from high school in 1995. There were about 3 of us that actually graduated, actually 4, with the highest honors in our class. So when they did the math, the breakdown ended up being tied for 3rd, but nonetheless, won numerous scholarships, ended up going to Xavier University in New Orleans, a great institution, another historically Black college and university, the only one that's Black and Catholic. So learned a lot at that institution. As a liberal arts school, we focused not only on, in my case, I was pre-med science major, but we also looked at the humanities. So I learned a lot about African-American studies, learned French, Spanish, even African-American music. So it's a great institution, allow for us to learn a lot, interact with people that come from either similar backgrounds or different backgrounds itself. So I was very fortunate. And even when I was there at Xavier, had opportunities to do volunteering work, even had opportunities to work in violence prevention. So I actually worked with a grant that was sponsored by the Department of Health and Human Services out there, and actually the Department of Defense as well, with violence prevention. So met a lot of great people, got some training, and graduated in the fall of 1998, or class of 99, and ended up going to medical school at Meharry Medical College in Nashville, Tennessee in 1999. And I'm very fortunate, got some great experiences while I was there. Even had an opportunity to get a master's in public health, which was focused on healthcare administration. So learned about Medicaid, Medicare, learned about environmental racism, learned a lot about what's needed for the next level as far as taking your career. But one of the things that I always remembered was it was one of our instructors. Actually, he was over the program, physician, and he reminded me or told me that public health is an opportunity to take care of patients globally. So that stuck with me, even whenever I actually had an opportunity to do a congressional internship with Congressman Jim Cooper, well-respected congressperson from Washington, and he represented the 5th Congressional District in Nashville. So had an opportunity to work on an op editorial, even had an opportunity to do some grunt work as a congressional intern. And when I say grunt work, answering the phones, picking up mail, things, you do your dues, but had an opportunity to see what a congressional office operated as. And staff was there helping people in the district. And that really made a lasting impression on me, because what it told me was that as a congressperson, as a representative, you have an opportunity to help people, beyond the hospital walls. And when you have these opportunities, you must take advantage of such. So after I graduated from Harry, I said to myself, I said, you know what, I could see politics being in my future, but let me focus on medicine. And, went to Baylor College of Medicine, was a great opportunity. Actually had an opportunity to sharpen my skills, learn new skills as a physician. But even while I was there, I had an opportunity to understand population health, working in Harris County of Houston, Texas, and seeing people from different backgrounds, people, some people like to say immigrants, nationalists from Mexico, just people who didn't have insurance, Black people, white people, and was able to use what I learned from my master's in public health studies, the biostatistics, the epidemiology, and to make better decisions as a physician, as a young training physician. So after I finished my training at Baylor College of Medicine in Houston, I did become board certified, and moving forward in 2007, actually started with the National Health Service Corps. And actually, I had made that commitment when I was back in medical school. And with the National Health Service Corps, I was able to work in underserved communities in Tennessee, in particular Jackson, which was a rural, urban, but more or less rural, also in Memphis and Nashville. And what was great about it is actually I worked at federally qualified health centers, institutions that are places where people can get quality health care from doctors, nurse practitioners, seen by nurses, individuals that actually can help patients who, whether if they had insurance or not. So got a great experience learning to seeing patients who actually had Medicaid, Medicare, private insurance, or no insurance at all. So that experience actually helped shape, my future focus, that you can actually represent and help people who are in underserved communities, whether it was rural or urban, and actually you can be their voice and actually serve as representation for them. And even while I had that experience in Tennessee, working at the federally qualified health centers, I even had an opportunity to become a medical director. Even though it was on an interim basis, I had an opportunity to learn how federally qualified health centers work. I even had an opportunity to do some state policy work with the state of Tennessee. And that gave me an opportunity to interact with individuals who are state senators, state representatives, and even have an opportunity to craft a report to state legislature. And with this particular experience, I was a subcommittee chairperson from programmatic options for this particular initiative that we did. So got some more leadership experience as well. In addition, I ended up working with the Tennessee chapter of American College of Physicians. And actually, we had an opportunity to participate in something called Leadership Day, where we would go to Washington and would advocate on behalf of patients. So that was a great experience. Even got a fellowship in American College of Physicians, which is one of the highest honors that anyone can get as a physician with internal medicine. It's one of the highest. It shows that you're involved with academics, ethics, and you practice competent internal medicine. So had a great experience doing that program. I even had an opportunity to be a scientific host chair for one of our science programs or scientific programs that we had with the American College of Physicians with the Tennessee chapter. So definitely grateful. Finished that in 2011 with the Health Service Corps. From there, I actually was a travel doctor So I would travel to different parts of actually the United States. I actually, traveled to Texas. It actually even came down here to Georgia. I actually worked in Lithonia with an organization called AIDS Healthcare Foundation. So actually, I did work with underserved HIV patient populations here in Georgia. Learned a lot about their programs as well. The ADAP program, those of us who've worked with HIV patients, a program that actually helps HIV patients get access to, I would say, limited health insurance, but also even some medications as well. So the opportunities that I've had, as a physician have been endless. So from that particular opportunity, ended up getting a permanent position with the local healthcare system here in the Atlanta Metro. Had a great experience with them, learned a lot. But then I decided I wanted to start my own practice. And I ended up going and getting a physician's executive MBA with the University of Tennessee. Great experience, met different doctors across the United States, and also met other students from other executive MBA programs as well. So we learned about the finance, we learned about accounting, we learned about economics, health economics as well. I learned about healthcare systems and what's important whenever we take care of patients, and how patient care, economics, the GDP, gross domestic product, how those things all interact. And it shaped me. And also I learned about organizational change management. So I got even more experience, in my opinion, with leadership, and also additional skill set to understand things like budgeting, policy making, how economics is important whenever you make decisions from a political leadership perspective. So came back, used that degree to help start my own medical practice. I'm actually the owner, the president, the general manager, and actually I do a lot of the accounting, obviously with the help of my accountant, but work with my accountant, and we look to get the practice going, and got a lot of experiences as a small business owner, even during COVID-19, how many businesses had to learn how to pivot. And like any small business owner, you're afraid when things happen. So got that experience, learned how to deal with the Payroll Paycheck Protection Act, learned a lot, EIDL, the Economic Injury Displacement Loan, those things that help keep my business going. So I can relate when small businesses have dealt with the pandemic, and how some of people lost their businesses, but also how some people were able to move forward and keep their business going. So decided to run for office, and it was something that I'd always wanted to do. This was back in 2019, 2020. Actually had some conversations with people with the state party, and decided to run for state rep. Now, when I ran for state rep, it was an interesting experience because I had never done it before. So obviously you're talking to people, trying to get advice, you're getting the education you needed as a first-time candidate. And what was interesting was that initially when I ran for state rep, and this is House District 49. So if people know House District 49, it's in Alpharetta, Johns Creek, one of the just an excellent place to live. I'll just say this. We have people here that are CEOs, they're doctors, they're lawyers, they're small business owners. So we have one of the highest average incomes, not only in this district, but we're in overlay 6th Congressional District. And if people know about 6th Congressional District, that's Newt Gingrich's old district. We even had Tom Price, physician, actually was a congressperson here, and now it's Lucy McBath. But we have one of the wealthiest congressional districts in the United States. So running for this position, you can only imagine Republican, conservative. So I had a tall order against me. And initially, I didn't have an opponent in my primary, but Democratic Party recruited someone, the person ran and had a primary. Initially, I was like, wow, I didn't know I was going to have a primary. But in 2020, I shocked the world and actually won my primary at 54%, which was tremendous. Young man, young doctor, Black man, actually, African-American, whatever how you want to designate. I consider myself a Black man, but won that. And this district is 62% white, Caucasian, and not saying that statistics will dictate, or not saying that demographics will dictate, but that's huge. That's huge for someone who had been in, we're now, been in Alpharetta for about 7.5 years. So for someone at that time, that was huge. So moving forward, going up against a Republican incumbent, someone that had been here for 20 years, Chuck Martin. I know a lot of people probably know him. Nice guy. In my opinion, been very complacent, but he holds a lot of the values here in this district, a Republican district, conservative. They like him. The gentleman was the mayor at one point. He grew up here. So sometimes change is something that people don't want. Sometimes change is something that people want to stay with. So the order was tall, but at the time, I ran the campaign. That's right. I ran it not only as a candidate, but as a strategist, as a manager. And it was through circumstance. When you're running for a position, you have to learn how to get donations. You have to learn how to fundraise. So that's something that I was doing. Now, some of you are probably asking why you didn't have a consultant. Well, I did have a consultant. Unfortunately, this particular consultant decided to leave for whatever reason. But for me, put on my pants. I said, hey, I have an MBA. I run my own practice. I'm going to use business principles. I'm going to operate with fiscal conservative skills. So got volunteers. I got people who actually wanted to work and help me. So actually, we had an excellent showing. We did raise funds. People did donate. And we had an excellent showing. So for a first-time candidate, I got 47.2% of the vote in a district that's Republican, it's red, it's conservative, and it's 62% white. So people are saying, well, why is this guy bringing up race a lot? Well, listen, people tend to vote for people that look like them, that they're more comfortable with. But 47.2% of the people that were here, and it does consist of 62% white, 15.9% Indian, 9.7% Black, and also Hispanic as well. So we have to look, and I'd say Hispanic, but also Asian American as well. So we have to look at that people looked at me as someone that can come in and represent them. So that's huge. And it wasn't just Democrats that voted for me. There were Republicans that voted for me as well. So I was able to interact with Democrats and Republicans alike, calls, texting. And I had people that still were going to vote for Donald Trump, but they said they liked my approach. They liked how I was a fiscal conservative, managed my own business. They liked the fact that they could trust me as a physician. And I ran on the platform of healthcare, especially we were running during a COVID-19 crisis, talked about Medicaid expansion, talked about making education easier, especially for our school teachers who need support. We even talked about improving transportation right here in Alpharetta. So people, in my opinion, gravitated towards me, not only as a candidate, but as a person. And hey, look, I take care of patients right here in Alpharetta. Some of my patients are Republican, some are Democrat, some are independent. So I consider myself someone who's open, someone who isn't just stuck or rooted in certain traditions or certain values. So even when I ran for office, I actually had an attack ad by the Republican Party where they said that I was too liberal, too radical or something. And these ads actually went across the state, even in Columbus. I had a friend of mine that was living in Columbus, and they called me and said, hey, they're running ads on you on Hulu on cable stations. And I was like, wow, must be doing something right when the Republican Party catches you and sees you as a direct threat to their district. So losing wasn't something that upset me. Obviously, you want to win because you play the game to win. You want to play championship ball. But what I do tell people is that sometimes a loss can be a blessing in disguise. And for me, I learned a lot about the political process, both political parties, Democratic Party, the Republican Party, learned a lot. So looked forward in 2021 and said, man, I really want to make an impact. Alpharetta is a great community. And I said the right answer would be to run again for House District 49. But looking at the state of Georgia, what we were going through, COVID was still going on strong. A lot of people died from COVID-19. People took that virus and also the vaccine and politicized it. Also, we were looking at healthcare crises where hospitals on the verge of closing, not only because of COVID-19 admissions, but hospitals were already hurting. Then also we look at how education was being affected. I knew people who were in the school system, and teachers, educators did a great job of pivoting when they went from being in the classroom to actually being outside the classroom at home. So friends of mine that had children, I mean, school teachers that I knew that had children, even they had to teach at home, but also had their own children looking to receive instruction. And then I'm hearing the stories about children who didn't have access to the internet, didn't have computers. And I'm also hearing about special needs children who they didn't have the same support as well. You're listening, you're hearing, you're seeing these things. And then SB 202 was passed. And those of us who understand history, or the word that people want to use now is critical race theory, those of us looked at that and said, wow, Georgia did a great job. And also other agencies did a great job of getting out the vote. We got our first Black United States Senator. We also got our first Jewish United States Senator. That's Reverend Warnock, and also Ossoff, Lucy McBath in the 6th Congressional District got a seat. Carolyn Bordeaux in the 7th Congressional District got a seat. We had some great people run. They were Democrats, and we say Democrats because people do attack and say, well, the Democratic Party was the hard party or the party of the KKK. That is true. That was the Southern white Democrats. But this is a new age Democratic Party that I like to tell people we switched over in the 60s with the passage of the 1964 Civil Rights Act. So this is the liberal progressive Democratic Party. So people who say, hey, we need to look out for people who are in safety net situations. We need to make sure that people's access to voting is preserved. So with the Republican Party, especially a Republican-led state Senate, and also a Republican-led House, and also a Republican gubernatorial office with Governor Kemp, decided to pass SB 202. And what it did was that it limits people's ability to vote in terms of having to go to the polls. It wants to, limit the ballot boxes. And because people who actually ended up passing this, they were, quote unquote, hearing that there was some improprieties with the election because President Trump didn't win. It was President Biden. But whenever you have your own Secretary of State who's Republican that says there weren't any improprieties, then what does that tell you? So to pass something like SB 202 that even doesn't allow outside entities to bring water to people that's in line, that's a problem. We already had problems with the scarcity of having poll workers. We also had the problem with the ID voter law that limited people, especially people who are transient from voting. And I say transient, college students, people who might have been in domestic situations where they had to move from one place to another, homeless people. Already using that ID to limit the ability to vote. And I say that, ability to vote. People should be able to vote on the same day. People should be able to vote, actually, to be honest, at any precinct that they want to. So when people talk about SB 202, we're looking at that as a direct threat by the Republican Party to prevent people from voting. Voting should be not only, it's a right, but it's something that should be preserved. And actually, we should be expanding it. We should give people the opportunity to vote by computer. I know some people don't like that, but we have advances in technology to allow that. We should continue to keep the ballot boxes. So people who maybe have an immune compromised disease like HIV or who are chemotherapeutic agents don't have to stand in line. They could drop the ballot box. Shift workers, people that work in an emergency room for 12 hours, the techs, the ER doctors, the nurses, someone that works as a factory worker. Those ballot boxes are great, especially when you're dealing with the mail system. Vote by mail is good, but as we're all aware, President Trump or former President Trump tried to slow that down. So what I'm telling people this, and I want to be clear about this. I know this is the words that we like to use, be clear. those of you who are Republican, Democrat, Independent, Libertarian, we should all look at the Constitution. We should protect the right to vote and also protect access to voting as much as possible. So what we ask is that, hey, how does this relate to the past? Well, after slavery, and you can debate all you want about slavery, and I'm not going to use that as the reason for why we're talking about voting. But after slavery, we had the highest number of Black United States representatives here in Georgia, Louisiana, Tennessee. We had bustling cities with businesses, grocery stores, banks, Freedman Bank, things of that nature. But what ended up happening, just like the town of Oscarville in Forsyth County, is that laws were created to stump the right to vote, things like black codes, grandfather clauses. If your grandfather couldn't vote, you couldn't. If your grandfather didn't own property, you couldn't. Those things were used to stunt the growth of Black progress. Now, some people don't want to hear this, but the Ku Klux Klan was born out of Pulaski, Tennessee by Southern white Democrats. That's right. I'm saying it here. And these people were domestic terrorists aided by government county agents that allowed them to attack Black families, Black businesses. And then you have that along with these laws, your ability to vote becomes stunted. This is why critical race theory is important. I mentioned Oscarville. That's a town that I just learned about a year and a half ago. Lake Lanier covers that town. And people are saying, well, what happened? Well, between 1816 and 1912, that town was thriving, but there was some quote unquote attack on an assault on a white woman. And these stories, we hear it all the time. They blame the Black man. And those of us who listen to our grandparents, who learn an oral history, for some reason, it was some myth that Black men wanted white women. So that myth was perpetrated in the past. So anytime there was an assault or some kind of false story that was perpetrated, they blamed Black men. So in Oscarville, what ended up happening in the 1900s and coming, 2 Black men were arrested. They were in their 20s. They were in the jails. Angry white mob pulled them away, hung them, telephone pole, killed them. And then slowly but surely, the KKK and the Night Riders, which is another domestic terrorist organization, pushed Black people out of this town. And those that remained were pushed out again until eventually the town became scarce, few families there, and the United States government, Army Corps of Engineers, the state of Georgia, decided to have a reservoir system for drinking water and also for hydroelectric water, for hydroelectricity, and then decided to flood that area. And guess what? Oscarville isn't the only one. There are other towns here in Georgia. There are other cities across the United States of America that were bustling Black towns. You hear about Tulsa, Oklahoma as well, was bombed. And not just bombed by local people. They were aided by the government. So people are saying, well, Doc, get to the point. What's the point, Doc? American history has been changed, omitted. And whether if you want to call it critical race theory or not, it's been omitted. So my decision to run for office was simple. We need truth. We need justice. We need people who are willing to stand up to bullies, whether they're in the government or not. And running for office is something that felt right. It's in my bones. And when you feel it and you pray. I prayed to my ancestors, to my God. I knew that this was what I was supposed to do. Running for lieutenant governor is an opportunity. When people look at the position of lieutenant governor, it actually is the number 2 position in the state of Georgia. Now, when you look at it, you're the president of the Senate. You cast tie-breaking votes. So you do have influence over a state Senate. Here in Georgia, it's overwhelmingly Republican. So Someone like myself who has appeal to not only Democrats and Republicans, I'm someone that can appeal to them. I am a fiscal conservative. I run my own business. I'm the owner. I'm the president. I'm the CEO. I'm actively involved in how things operate. And if you're not a fiscal conservative running a business, your business will fail. Same principles I apply to the campaign as well. But also, the lieutenant governor's position historically hasn't done anything else outside of that. But what I look to do now is to bring value added to the lieutenant governor's position. You know, I'm someone I mentioned, I have a master's in public health. I've studied the Medicaid and Medicare program. I've worked on the ground as a physician with the National Health Service Corps. Actually, I'm even a Georgia Medicaid doctor. So I understand when patients don't have health insurance, you're the working poor, your employer can't afford to give you health insurance, you're working as a waiter, a waitress, beautician, barbershop owner, small business owner, you can't afford. But you don't make enough, or excuse me, you make enough in which you don't qualify for traditional Medicaid, and you're not disabled, so you don't qualify for Medicare, and also you're not old enough to qualify for Medicare as well. And also the skyrocketing insurance premiums are difficult. So why not have somebody in a position of leadership who understands the programs, who knows Medicaid from a policy perspective, but also knows it from a practical perspective? Who better than to advocate for Medicaid expansion than someone like Dr. Jason Hayes? We passed Medicaid, 400 to 500,000 people have access to health insurance. That's affordable health insurance. And also, we need someone who understands what it takes to get doctors to underserved areas, not only here in Atlanta, but Columbus, Albany, Valdosta, Warner Robins, Macon, Habersham County, Gainesville, Athens, Rome, Dalton, Union County. Didn't forget about you. We need people who understand how to utilize federal funds, Department of Health and Human Services, HRSA, Human Resources Services Administration, and to help communities, and also the state push to help these communities apply for Public Health Service Grant Section 330 to get community health centers. And with these community health centers, you can recruit doctors who want to take care of patients in underserved communities, nurses, mid-level practitioners like nurse practitioners, PAs, people who want to be in rural communities to help people. We have 148 counties that are deemed medically underserved. And we have some counties that don't have pediatricians, some counties that don't have obstetrics and gynecology, internists. Those are ways in how you can do it. And it will not cost the state of Georgia a dime to utilize the Public Health Service Grant Section 330. And also, we need someone that understands the reimbursement rate. I'm a Georgia Medicaid doctor. I understand it. I know it. I've talked to doctors on the campaign who want to see Medicaid patients, who want to help. But the reimbursement rate is so low, and it hasn't been raised since 2000, that they can't afford. They want to give good care, but they can't afford to. So we have to look at ways to educate State House, State Senate, the governor, that we have to raise the reimbursement rate. So we have to incentivize doctors to see the patients, and also work with healthcare systems who are willing to take on the new influx of patients that we'll have. But we need someone to quarterback that. We need someone who's going to come in and say, you know what? I understand this program. I've learned it. Let's do this. I can be value added to the governor's cabinet, value added to the lieutenant governor's position, and be an asset to the governor. And also looking at education. We have got to support our school teachers. We've got to raise their salaries. We've got to be in a position where we can recruit and retain. We've got to get social workers in these schools. We got to get more resource officers, because students are hurting at home. We're dealing with situations at home where people are in disenfranchised situations. People don't have jobs. Children are bearing the weight of a lot of this. And some of them are coming to school hungry. Some of them coming to school dealing with domestic situations. And it's affecting their ability to learn. And it's not just in urban areas. It's happening in suburban areas too. So We have got to start looking at the whole spectrum, and we've got to start helping children, and how we help children, support the teachers, make sure they get better pay, make sure they get better support, make sure we support the public school systems, and make sure that they're adequately funded, so we can make sure that we get our students where they need to be. Georgia is a great state, but we also got to continue to push forward with better scholarship opportunities. And also, we got to make sure that young people have access to trade skills, HVAC, home ec, learning about mechanics, being a mechanic, electrician. When people learn these trades, these skills, they can actually be in a situation where when they graduate from high school, they can actually start their own business. And I say start their own business, we can start teaching them practical finance in high school, business skills, how to do a business plan. When we do this, whether a young person decides to go to college or not, they will have the skills. They can come back and help their community, make their community stronger, better. That's how you get economic growth and help to make communities self-sufficient. And then even pushing forward, we want to have economic growth. We need to leverage and work with corporations. You know, I looked at the budget and my God, we pay more personal taxes as a source of revenue for the state than corporations pay. We talk about them paying their fair share. We've got to raise the corporate tax rate not only in the state, but also federally. I'm someone that says, hey, if a corporation is like, well, Doc, I don't want to pay taxes, that's fine. Will you be willing to come to a community and support a community and actually focus on community hiring, community training, so we can help rebuild these communities and get infrastructure going? That's how you improve economic growth in urban, suburban, but urban areas and rural areas as well. And then finally, we have talked about SB 202. It has to be repealed. As of right now, I am hearing that there are individuals in the state house, state senate, they're working feverishly to make sure that we get this repealed. But in the event it's not, I promise to get it repealed, and I promise to work with the Secretary of State and the governor. Obviously, the governor would have to give me powers to do such, but to work and to make sure that everyone's access to voting is there. Vote by mail, absentee, ballot boxes available. And yes, they should be under supervision. And making sure that we expand the ability to vote by computer with strong cybersecurity, and also to make sure that everyone exercises their ability to vote. And that's including making sure that hours at the stations for early voting, 7 a.m., heck, 9 p.m. Again, people are shift workers. They have to have access. Got to support our poll workers. We got to recruit them. We have to get them in positions that so they can be successful as well. Everyone should be on the same page for this. Republicans, Democrats, Libertarians, everyone. So as a recap, running for lieutenant governor here in the great state of Georgia. We're raising funds. We're calling. We're talking to people. We're doing great things. And there are a lot of people out there, not only here in Atlanta, but Augusta, Valdosta, Columbus, Savannah, south of Georgia. They're looking for change, and not just any old change, but we need good people who are going to listen to people and be willing to work with state senators, state representatives, the governor, and bring value to the lieutenant governor's position. Nothing against my 6 other opponents. They're great people. And I'm talking about in the Democratic primary, there's 6 of us. There's 1 Libertarian, and there are 4 other Republicans that are running the Republican side. Nothing against them. But out of all of them, I have tremendous amount of appeal to Democrats, a tremendous amount of appeal to Republicans, to young people, older people, people who grew up in the rural communities, because I grew up in a rural community as well, or a rural working class community, but I also live in a suburban community as well. So I can relate to everyone, and I'm looking forward to the challenge, looking forward to working with people, looking forward to doing some good, and also to make Georgia a great state. And we've got to continue to work on that together. So this is going to conclude my first podcast. Dr. Jason Hayes, candidate for lieutenant governor here in the great state of Georgia. I know our people, I wanted them to be on Facebook Live to ask questions, and we had a little snafu with it. But what we're going to do next week is I will be recording the podcast, and we'll go ahead and not only we'll put up podcast number 1, we'll put up podcast number 2. I did briefly talk about critical race theory, did briefly talk about SB 202. So next week, what I will do is we're going to do more of a deep dive into critical race theory. That seems to be a very much of a hot topic right now. There are people in the state Senate and state House right now that are trying to get critical race theory removed. As a matter of fact, I'm getting a lot of hate responses and negative responses from people across Georgia through some of my posts that I'm putting up. So we're going to talk about it more next week on the podcast. And I am going to sign off. It is Dr. Jason Hayes, candidate for lieutenant governor here in the great state of Georgia. First podcast debut, Beyond the Race. Next week, again, we're going to talk about critical race theory and how this relates to voter access, and also how that relates to communities of color and what we need to do to make sure that we continue to teach about critical race theory, and also what we need to do to improve society as a whole. Thank you again. And this is your candidate, Dr. Jason Hayes, host for Beyond the Race.